Morning, Ms. Yamakowski.
Morning.
How you feeling today?
Dr. David Basil is making his morning rounds at Mercy Medical Center in Cedar Rapids, Iowa. With his stethoscope around his neck and his smartphone by his side, he checks on the progress of his patients. His stethoscope lets him listen to his patient's heart.
Looks like all your potassium and your kidney function, everything looks pretty good today.
His smartphone tells him everything else.
I always have access, wherever I go, whether it's either my PDA handheld version or my laptop. Yeah, I always use it there, and so I never have to fight for a computer somewhere or try to track down the chart.
Dr. Basil used to spend much of his day wrestling with various hospital systems for the clinical information he needs and administrative duties he's required to perform. Now he gets to spend more precious time with his patients.
You can make a clinical decision with the most information at your hand and in an efficient manner without having to flip back and through different areas of the chart, or maybe going to the patient room, coming back out of the patient room. And the more information, the better decision I can make.
Hospitals and health systems have become increasingly digital in their health records and overall workflow in recent years, which has helped to consolidate the copious amount of information that physicians need access to on any given day. The problem, though, is that physicians have had to spend too much time trying to get that information into their hands.
They had multiple passwords. What they would probably do is rely on the nurses then to gain them access. So the easier you can make it for any user to use technology, the more likely that they will use it.
Mercy Medical Center integrated all its data into a single physician information system into its operation. This single unified view of patient information gives physicians and hospital staff instant access to a whole host of information, from clinical to financial to administrative information from a variety of systems in the facility.
The challenge has been, from a physician perspective, that 20 years ago they would show up at a patient's bedside and grab a chart and have everything they need to treat that patient. Now that information is scattered across multiple different computer systems with different user IDs and passwords and different user interfaces. So from a physician's perspective today, in many hospital settings, the process of taking care of a patient and getting all of the information you need to make an informed clinical decision is actually more difficult than it was back in the paper era.
What we found is if you give them the information in a user-friendly way that matches their workflow, they'll actively use it for patient care, and they don't have to go hunt for it when they need it.
In our field, I need direct access and quick access to all of the information available. Let it be medications, the vital signs, what the nurses are seeing, and laboratory results.
One of the challenges that we face in order to be successful is that we have to automate the entire day in the life of a physician. The challenge with that is that doctors do lots of different things. So we have a whole array of workflow applications to support the physicians throughout their day. Everything from being able to write a prescription, to being able to review clinical results, to enter a charge, to sign out to other caregivers when they're done with their shift or they're going on off call for the weekend, to be able to document the encounters that they have. A variety of different workflows that are inherent in a physician's day that all have to be automated, or this idea that you have one system where you can do all your work breaks down.
Physicians are highly mobile, providing patient care across many settings and locations. Multiple hospitals, office, clinic, nursing homes, giving them access to patient information wherever it's needed is critical.
I've been speaking at some conferences, and that evening I'll just log in and check, make sure my patients are doing okay, catch up on my signatures, and check my email. Just like I would check my home email, I can check on my patients at the same time.
When information is delivered where it's needed most, it can truly enhance patient care and safety, reduce costs, improve staff productivity, and increase revenue.